Hi, I'm Reema, Pharmacy Manager at Randall Mill LTC Pharmacy.
Hi, I'm Patrick. I'm the Pharmacy Manager on the retail side of Randall Mill Pharmacy.
So today we'll be talking about colorectal cancer, what it is, some symptoms, and what can be done to prevent it. So Patrick, what is colorectal cancer?
So to begin with, the colorectal area of your body is actually part of the large intestine. It's the very end of the large intestine. You have your colon and then you have your rectum, and this area combined is often referred to as the colorectal area. So today we're going to be talking about cancer in that area. Cancer, just in general in your body, occurs when cells divide uncontrollably and they're not checked. And so colorectal cancer specifically presents usually with polyps in the beginning, which is just an overgrowth of tissue. Again, the cells are dividing uncontrollably. But if polyps are not caught, then this can lead to cancer that can eventually spread throughout the body.
Okay, So what are some symptoms of colorectal cancer?
Okay, so things to look for in the initial stages of colorectal cancer would be diarrhea or constipation that won't go away, just continually is happening over and over again. You would look for things like rectal bleeding, change in normal bowel habits, or even discomfort or the urge to have a bowel movement when you actually don't have to go. Also, excessive fatigue and weight loss that happens without any type of dieting. Those are also signs of cancer.
Okay. Now that we know some signs of colorectal cancer, what are some risk factors that contribute to this cancer?
Sure. So the most common risk factors associated with this type of cancer, the biggest one is age. People age 65 to 74, that's the age range that you most often see a diagnosis of colorectal cancer. Another risk factor is race. African Americans have the highest rate of colorectal cancer among racial groups in the United States. We're also looking at family history. So if you ever had a dad, mom, grandma, grandpa that had polyps or colorectal cancer, that's a big indicator that you may also need to watch out for those kinds of things. Anyone that has inflammatory bowel issues such as Crohn's disease or ulcerative colitis, they're more likely to get colorectal cancer. And then lastly, a lot of people have heard this, I'm sure, but diet is a big one, specifically red meat. So we're looking at beef and pork. A diet high in those things tend to put you more at risk for this type of cancer, and also processed meat. So deli meats, things like hot dogs. A diet high in those products also can lead to higher risk of this type of cancer.
Okay. So now that we know all about colorectal cancers, is there anything that we can do to prevent colorectal cancer?
Yes, and when it comes to this type of cancer, prevention is key. You definitely want to think about getting a colonoscopy starting at the age of 45. So adults 45 and older, especially if you have one or more of the risk factors I just talked about, family history, diet, age, you definitely want to talk with your doctor about getting a colonoscopy. This type of cancer is very treatable if caught early. If you catch it in the polyp stage, the doctors can take care of it. If it starts to spread though, it gets harder and harder to treat. So again, I can't emphasize enough, prevention through a colonoscopy or a similar alternative is very critical with this type of cancer.
So today we discussed about colorectal cancer, what it is, the symptoms, and ways to prevent it. The information on this video was provided from MD Anderson website. Please remember to like, share, subscribe, and follow us on Facebook, YouTube, and Instagram. Stay safe, stay well, and we'll see you next time.